Hi, I'm Tom Lynch. This is In Focus Fridays. The pandemic has accelerated the use of all kinds of interesting technologies, from video chat to food delivery apps to virtual reality. But even before the pandemic, Fred Hutch researchers have been thinking about how can we use new technology, particularly in the area of preventing cancer and related diseases. Today, I'm really lucky to be talking with Dr. Jonathan Bricker from the Hutch's Public Health Sciences Division about how his research into mobile apps, chatbots, and other tools can be combined with cutting-edge psychology to help people adapt healthier habits that can reduce their cancer risk. Dr. Bricker recently received an $11 million in NIH grant funding, including an NCI grant to run a randomized controlled trial comparing two smartphone apps to see which is better at helping cancer patients to stop smoking. And as all of you know, smoking is an extraordinarily common cause of preventable cancers: lung, head and neck cancer, bladder cancer, pancreas cancer. Obviously something we very much want to see reduced across the population. So Jonathan, you have a number of ongoing studies. What kind of technologies are you using now?
Well, Tom, first, thank you for having me on this segment. For the past decade, we have been designing, developing, and testing telephone coaching and smartphone apps and websites for tobacco use, and now more recently for weight loss. And we do this because tobacco and obesity are the most preventable causes of cancer. 4 of all cancer cases are due to tobacco use. Over 600,000 cancer cases each year are due to being overweight or obese. And technologies have high reach. With apps now reaching over 80% of American adults, with very similar levels of reach for Black African Americans, Hispanic, Latinx, for low income, for rural populations. Smartphone apps have high reach. In fact, for quitting smoking, they've reached about 33 million people. And telephone coaching programs reach about 1 million people per year. But there's a lot of junk out there. Our mission is to change that. And we developed these technologies to impact the science of public health, and in turn to offer the public proven effective treatments for preventing cancer, and most importantly for quitting tobacco and for losing weight.
So Jonathan, one of the things I'm curious about is, listen, we all have tons of apps on our phones. And as you point out, some of them are junk. And yet you've done a lot on this connection between psychology and the apps to make it more effective. You know, I know as a lung cancer doctor that getting patients to quit smoking is extremely hard, very difficult to do. So tell me a little about this connection between a great app and great technology and the psychology it embraces to try to promote adherence to smoking cessation.
Well, as a behavioral psychologist who was trained in the late 90s at the University of Washington Clinical Psych Program, I have to say that the last decade has really been my dream, because now we're able to get rigorous, principle, theory-based behavioral psychology out to the public through technology. You know, when I was trained in graduate school, the main way you reached a patient was individually, face-to-face, or in a group. And over the last decade, that has changed fundamentally. And I think there are two connections that are really worth noting here in what I consider the most important decade for behavioral psychology in terms of making public health impact. And the first is an innovative approach to behavior change called acceptance and commitment therapy, or ACT. The accept part of ACT is to notice and allow your physical sensations, your emotions, and your thoughts that trigger behavior, that trigger tobacco use, that trigger unhealthy eating. To notice them, allow them to come and go on their own without trying to push them away, without trying to avoid them, but just to let them be there and make room for them. And there's a series of skills on how to do that. The commitment part of ACT is knowing what matters to you. Everybody has values. Everyone has things that matter to them deeply: their family, their health, their relationships. And in our treatments digitally, we're able to help people articulate those things that really matter to them. And we've taken ACT research, which we've been doing for 13 years, and we've figured out how to translate a very complex and intensive set of intervention techniques that normally we would deliver face-to-face with a patient and make them readily communicated in an app, readily practiced in an app or a website, or in a 15-minute telephone coaching session. And anyone interested in learning more about ACT can watch my TEDx talk on it, which they can find online, or numerous books on ACT. I think the second connection is through gamification. Games are a ubiquitous part of our lives now, and it's very common for people to get hooked on games. So we took the principles of gamification and we applied them to engagement, because there's a lot of competition for eyeballs. It's very easy for people to get bored or get distracted from whatever digital technology is in front of them. And so what we've done is we've developed systems that move you through levels to unlock skills as you go along through the program, and also to move your way through the program based on your progress in changing behaviors, like how much weight you've lost or how many smoke-free days you've had. And then we provide stats on your progress, like the minutes of life you've gained by how far you've come in the program.
But John, but one thing I would worry about, the craving a smoker has is extremely physical as well, okay? Meaning they want that nicotine, okay? How do you overcome the strength of that craving? And how does the the acceptance part of it seems fantastic in abstract, but does it really work in practice when you've got this strong physical urge to smoke a cigarette?
It does. I'll tell you that one of the features that we have in our program is an immediate urge help menu. We have about 300 different quick strategies of noticing a craving, letting it pass, 3 breaths, letting your cravings move down a stream you imagine, different quick things you can do right in the moment, right the time you're having a craving. What we found in our data consistently across our trials, and we've run about 7 different randomized clinical trials, various versions of ACT in various platforms, digital technology, telephone, is the single best predictor of quitting smoking is increasing acceptance of cravings. And of all the different processes we've looked at in terms of what is it that's going to lead someone to that 1-year outcome, because we go out 1 year in our main outcome variable, that single best predictor is being willing to let the cravings come and go on their own. And in fact, it's the underlying principle of the digital technology that has been transferred, digital through a licensing agreement through a company that licenses our app. That is the main selling point that they emphasize when they're getting employee wellness programs, when they're getting insurance companies to pick up this program. They say, well, what's the data? And they show them the efficacy data. And then they tell them, how does it work? Well, it is that acceptance of craving, which is the core element for it. So the short answer is it does work. It often takes people practice, and often we will get an initial skepticism. Someone might say, I can't do that, or I don't want to notice this experience. I want to avoid it. And so we built into the program ways to help them overcome this initial skepticism, which is basically to give it a shot. See what happens.
And Jonathan, does using nicotine replacement therapy at the same time, does that counter what the app is trying to do? Do you ever use those things together? How do you think of that?
Well, it's interesting. In our latest trial, about 25% of people used it on their own. So we're just testing, if we just give people this free program, are you going to boost your success rate? And we just completed a trial that was published in JAMA Internal Medicine, where we compared our I Can Quit program based on ACT for quitting smoking with 2,400 people recruited from 50 states throughout the United States, all 50 states. We followed them at 3, 6, and 12 months. And we found is if we just gave them an app, no nicotine replacement therapy, if we just gave them an app, they had 50% higher success rate at the 12-month follow-up using this I Can Quit approach versus the National Cancer Institute's Quit Guide, which teaches you how to avoid your cravings, which is the standard US practice guideline approach. And so 25% of people in I Can Quit used nicotine replacement therapy on their own. And we're going to be looking at whether that actually boosted their success. What I can say is that people who use vaping, which they often see as a kind of nicotine replacement, we just published a study with my colleague Noreen Watson that showed that people who used e-cigarettes in our web-based program were actually less likely to succeed at quitting smoking. It was very counterintuitive. And of course, with the FDA-approved nicotine replacement therapies, that's something we're going to be looking at on their own. I do also know that a small study that the Joint Lewis McCord just completed with an earlier version of our app-based program find that adding nicotine replacement therapy added anything to the success rates, and I'm aware of that as well. So it's very interesting. One would think the combination would work best. I've often recommended that people use the combination of NRT or varenicline, also known as Chantix, along with a behavioral approach, and that is the standard. But I think the jury's out on whether this combination is going to actually be effective for this app.
So, Jonathan, that's a fantastic example of the importance of how cancer prevention and behavioral psychology can interact to lead to better outcomes. And as everyone knows, early detections of cancer and prevention of cancer is an enormous goal of the Fred Hutch. It's something we have devoted years to, and the work that you're doing, Jonathan, is a wonderful example of that in action here at the Hutch. I'm Tom Lynch, and that's In Focus Fridays.